Now to influenza's impact on Tarrant County. MedStar crews are treating 3 times as many patients with flu-like symptoms as they did last year. And it's getting worse. In November, crews were treating 4 patients a day on average, double what they did in October. MedStar is encouraging people to take basic precautions, things like covering your nose, your mouth when coughing and sneezing. Wash your hands, we do mean frequently, with soap and water. Avoid touching your face and clean your computers and countertops with disinfectant. That's an area that we touch often, at least around here. And when it comes to kids, Fort Worth ISD says if your child is sick and can't come to school, they don't need a doctor's note for that absence to be excused. Just call the school, let them know what's going on, and you can write a quick note yourself when you send them back to class. Well, so much illness going around right now. I want to bring in our medical expert, Dr. David Winter from Baylor Scott White Health. Good morning, Dr. Winter. Look, there seems to be a lot of sniffling, coughing, sneezing out there. Are the cooler days producing more viral illnesses?
Well, they tend to do that this time of year, and this year is no exception. You said flu cases are on the rise. They've been steadily increasing the last 3 weeks in a row, and as of this week, they've overtaken COVID, meaning more new cases of flu than new cases of COVID right now. You've also got plenty of COVID out there, and some of the experts are saying we expect a big surge of that to come up in the next month or so. RSV is settling down a little bit, but still a lot of those cases out there also. All these are viruses. All of them are airborne, spread through the air, and they're just looking for a chance to infect you. So be careful out there.
Definitely be careful. Look, in regards to flu, I want to go back to that. When it comes to medication to treat it, such as Tamiflu, it's said to be in short supply. What are you recommending for treatment?
Yeah, Tashara, all of the antivirals that treat influenza are in short supply right now. It goes along with the increase in the number of cases. So if you can't get those drugs, prevention is the best thing to do. If you hadn't got a flu shot, I recommend you get one. Be careful in crowds, and when you see somebody coughing or sneezing, go the other way.
I know that kind of sounds rough, but literally, when I see somebody coughing and sneezing, I hook a left the other way all the time. Look, we hear that monkeypox is changing its name to mpox. Why is that?
Yeah, it's always been a misnomer. The disease never came from monkeys. It actually was in monkeys in a lab in 1958 in Denmark, but never went to humans. The first human case was in 1970 in Africa, and that came from rodents. So it never came from monkeys, and so they're going to change the name now to mpox, more appropriate than monkeys. Monkeys don't need to be blamed for this one.
In other health news, Alzheimer's research is progressing and new medications on the horizon. Tell us about some potential new treatments.
Yeah, a new article in New England Journal of Medicine about lecanemab. It's been studied to help slow down the progression of Alzheimer's. And what they found over 18 months of the folks that got this drug versus placebo, 27% decrease in mental decline, mental cognition. So sounds like it's pretty good. FDA has not studied this yet, hadn't approved it, so it's not available. Hopefully after the first year, that will be another thing we can use in our armamentarium for Alzheimer's. We need more medications to treat this cruel, awful disease.
All right, Dr. David Winter, always a pleasure to have you. Thank you so much for joining us on Midday.
Good to see you, Tashara. Have a good day.
You as well.